by GRTS.
The First Lady concluded her tour of health facilities in the Greater Banjul area on Friday with an extensive tour of the Royal Victoria Teaching Hospital. Asad Bajansar has been with Madam Zainab Yahya Jame, and this is her report.
Royal Victoria Teaching Hospital, the final port of call on Madam Jame's familiarization tour of healthcare delivery centers within the metropolis area, was an intensive one. The RVTH is the country's main referral center and a facility housing major medical infrastructure of the country. But like all facilities visited earlier on, it also grapples with many challenges. The First Lady's tour of the RVTH started at the telephone exchange facility, which is currently dysfunctional. From there, the entourage proceeded to the accident and emergency ward, then to every unit of the hospital. Even the mortuary, kitchen, laundry and security units of the vast hospital complex was visited by the First Lady, with time taken to know the constraints each of these units is battling, all geared towards aligning her efforts with that of the government in working towards enhancing the country's healthcare delivery system. Since Her Excellency Madam Zainab Yahya Jame started her tour of health facilities, we took her to Fajikunda, Jame Foundation, Serekunda Health Center and General Hospital, Bakau and the Polyclinic. The constraints faced by these facilities are similar. The lack of proper facilities, more qualified and specialized doctors, inadequate nurses, an effective information system, and in some cases water and electricity and mobility are issues that need to be addressed if the health sector is to achieve its overall objectives. There is hardly a unit that is not battling with problems, but there are few among the lot that raise eyebrows, and these include the records office of the RVTH, which according to officials is seriously affected by the lack of an information system.
How long does it take you to find a document here?
Yes. Usually there is
to have a information system here. That's what they need, and we need to get a team to come and log this information into the system.
Exactly.
You know, we need to digitalize this system. We did that before at GRTS when I was there.
Yes.
And that's the same project that needs to come here. Now there's a proposal from a university, American International University, to send us a information system here to pilot it. But I'm not really sure how far it's gone, but we send a team over here to work with you and see how best they can jumpstart the project.
The intensive care unit is also another unit of concern to the authorities. One can imagine a critical unit of such operating with few life support equipment.
It is a whole big challenge. Even ordinary monitoring for us to know when to intervene, and we can't do that. So we monitor the little we can manually. Now, even oxygen concentrators have become a big issue, because since we are unable to have mobile oxygen bottles, we need concentrators. Ideally, each bed should have an oxygen concentrator, a BP machine, and even trained personnel. Training is also very important, because most of these people are not trained as to take care of very, very sick people. They did on-the-job training, so we need...
How many doctors do you have in this unit?
Yeah, we
Only
have...
one doctor?
Doctors, clinical staff, nurses, and even the patients in these facilities are feeling the pinch of these constraints and thus calling for more efforts to remedy these situations. Despite some of the achievements registered in the health sector, it is obvious that more needs to be done if the Gambia is to attain an effective, efficient, and robust healthcare system, with hopes that with the First Lady's tour of these facilities, some of the constraints highlighted by health officials, if not all, will be addressed soonest. Aisato Bajansar, GRTS.
Female executives, professionals, and leaders from Africa have been seeking to broaden their networks and exploring ways of bettering the lot of the women folk. The 4th African Women in Leadership Conference kicked off on Wednesday. Mama J reports the conference theme is Africa Women Empowering for Action.
Conference seeks to harness and enhance the skills and potentials of women in leadership positions in Africa, as well as enlighten and encourage those aspiring women to leadership positions. The founder and the Chief Executive Officer, African Women in Leadership Organization, Elisa Atai, noted that AULO is a non-profit making body that has a membership of women leaders from across the continent.
The topics for this year's edition are quite out and well carefully selected to cover all aspects of the African women's life in relation to politics, education, science, technology, and innovation, social health, and spiritual well-being.
The Director, Gender Directorate of the United Nations Economic Commission for Africa, Thokozele Rezaider, recalled Vice President Jai Seidi's personating words during the last Beijing Plus 15 conference that moments of declaration and commitments are over, noting that it is now time for action, a call officials say this conference is heading to. Madam Rezaider hailed Gambia government civil society relations, adding that the collaboration between the two partners is key.
This year's partnership with the African Women in Leadership Conference is a recognition that as a knowledge institution, we need such organizations to give us information, to enable us to define messages for policymakers that we ourselves in our ivory tower in Addis Ababa would probably not have. Therefore, such conferences do give us critical issues that we can share with member states. I want to acknowledge the work of Elisha and Edith in getting this initiative off the ground.
The Deputy Speaker and Chairperson of the National Women's Council, Honorable Fatumbai, deputized for the Vice President and Minister of Women's Affairs, Dr. Aja Aissatou Seidi, in delivering the keynote address.
With the Gambia, under the support and dynamism of His Excellency, in its show of demonstrable political commitment, has established an appropriate institutional and legislative framework to promote the well-being of women, men, and children.
Honorable Mbai highlighted the numerous interventions and policies formulated by government in empowering Gambian women.
Regarding the protection and promotion of the rights of Gambian women and children, government since the advent of the Second Republic has made significant inroads in the attainment of equality, equity, and the empowerment of women in line with international conventions and protocols, like the Convention on the Elimination of All Forms of Discrimination Against Women, CEDAW, and the Protocol to the African Charter on Human and People's Rights on the Rights of Women in Africa.
Although significant gains have been registered in empowering Gambian women, challenges for gender inequality persistently exist, especially in access to and control over productive and financial resources. The three-day conference will Friday honor African women who have distinguished themselves in their various fields of endeavors. The women leaders from across the continent were entertained by the popular Kabakel and Kanyeleng groups.
The presiding judge in the trial of the Commissioner General of the Gambia Revenue Authority, Justice Emmanuel Nkea, has deferred his ruling on the bail application by Defense Counsel Badu Conte to Monday, June 18th. The development comes as the state filed an affidavit to oppose Defense Counsel Conte's bail application for his client. Mamadou Jallo reports.
The former Commissioner General of the beleaguered Gambia Revenue Authority, Bahari Sanyang, who has had his bail applications adjourned several times, this Friday again applied for bail before the Special Criminal Tribunal presided over by Justice Emmanuel Nkea. Mr. Sanyang is accused of neglect of official duty, perjury, making false and misleading statements, defraud of the government tax revenue, economic crimes, and uttering false documents. As head of the Gambia Revenue Authority, Sanyang and 3 others are accused of neglecting their official duties, thereby causing economic loss to the government of the Gambia of over $2.5 billion. When the case resumed this morning, the counsel for the accused, Badu S. Conte, applied to move an affidavit filed on the 11th of June, requesting bail for his client. Citing various sections of the Constitution and the Criminal Procedure Code, Conte urged the court to order the release of the defendant on bail pending the finalization of formal charges. There is a presumption that bail should be on the favor of the accused, because every accused person is presumed innocent until proven guilty by a court of law, Conte posited. He argued that the accused had been held since the 6th of June without bail, insisting that the charges against him are bailable. He said the accused had been working for the government for 38 years, has a family, and wouldn't therefore jump bail. If detained,